More than 62,000 Ohioans were diagnosed with some form of cancer just last year. About 24,000 did not survive. And while the numbers are daunting, there is reason for hope. The number of deaths in certain forms of cancer are declining, due in large part to advances in treatments. And one such advancement is the focus of my first guest today. You may have heard about Columbus CyberKnife. Here to tell us how it differs from traditional radiation treatments and if it's possibly right for you, the Center's Medical Director, Dr. Doug Widman. Doctor, nice to have you here.
Thank you for having us back.
We have heard of CyberKnife. What is it when you say it is targeted radiation? Because that's what's different about CyberKnife.
Yeah, it's different from conventional radiation in that we can focus it to a very small area. So we do a much better job keeping the radiation away from surrounding structures with a technology like this.
Is this groundbreaking?
I think it is. I think it really is an amazing technology that I think is changing the way we think about radiation therapy. So, yes, I think it's groundbreaking.
Well, let's explain the difference in radiation to chemo and different things like that, Doctor. So who would this be good for?
Well, radiation therapy is used many times with chemotherapy.
So they can be used in tandem?
They can. They most certainly can. And for certain cancers, it's the best strategy. Lung cancer, for instance, many times we want to use both chemotherapy and radiation. So we're trying to attack the cancer from two different directions.
So radiation is targeted and chemo then goes more throughout the whole body to, as you said, attack it on two different fronts?
Exactly, that's right.
So what kind of cancers would best be used or that CyberKnife would be a good alternative?
Well, it's a very good way to use radiation for treating various types of tumors in the brain. We use it to treat lung cancer, prostate cancer, difficult to reach cancers around the spine.
Mm-hmm. And that's the importance of the targeted part. You only want to hit the part that you need to hit.
That's right.
You talked to me earlier about brain cancers and how CyberKnife could be used for some brain tumors. Mm-hmm. And I would think that would be very important because the brain there's so much in the brain and you are only looking for a particular spot.
That's right.
How do you go about attacking those tumors?
Well, many times we're asked to treat brain metastases, for example, which are cancers that spread from other places in the body.
Brain? Okay.
That's right. And unfortunately, many times they can cause unfortunate symptoms. But the idea with radiation is to try to treat these tumors, shrink them down, and try to get rid of symptoms. And it's nice to be able to not expose the entire normal brain to radiation. So that's where CyberKnife is a good option.
Now, tell me if I'm wrong here, but I thought that targeted therapy in radiation, that we've already have some sort of targeted therapy. So how is CyberKnife different than what's already been out there?
Well, you're right. You're right. There are many amazing ways to make the radiation more targeted, and CyberKnife is not the only technology that can do that. But the thing that sets CyberKnife apart from I think all other technologies is that it is very able to follow tumors that move with respiration. Any type of moving target, CyberKnife does a very good job with, and that's difficult with conventional radiation therapy. So that's why lung cancer, for example, is a good target for CyberKnife. The other thing with brain metastases, with other radiosurgery technologies, a frame has to be bolted to the skull. With CyberKnife, we don't need to do that. So it makes the entire process easier for the patient, for the treatment team, and also speeds up the entire treatment process.
I was going to ask, what are the benefits for the patient? Obviously, it's the targeted therapy, right, but what will they feel from it?
Well, a typical treatment lasts anywhere from 30 to 60 minutes. The patient will feel nothing. I mean, they get up off the table and literally walk right out of the department and should have virtually no side effects, hopefully none.
I think that when people say CyberKnife, it implies that it's surgical or cutting, and that's not the case here, right?
Not the case at all, and I hear that from everyone, and it's probably not named very well. I'm not sure why it was named CyberKnife. We obviously had nothing to do with that, but yeah, it has nothing to do with surgery. It's just to imply that it has the accuracy of a scalpel, but it's not surgery in any way, shape, or form.
Can people ask their doctor for this, Dr. Widman, or how do folks end up being able to use CyberKnife? Is it up to a patient?
It is, and at this point in time, since we're still new to the Central Ohio area, we have a lot of patients that contact us directly with questions, but it's nice to get referrals directly from their patients, but at this point in time, a lot of patients do call, and sometimes, could come in and talk to us. Many times there are options. There's no one best way to treat a cancer, and so they might come in and talk to us, and sometimes they decide to do CyberKnife, sometimes they decide not to.
So this is another option that's out there for folks that they should ask their doctor about.
That's right.
Well, we have all that information on our website, Dr. Widman. This has really been an education. I appreciate you being here.
Well,
and good luck with this new technique. That's, I'm sure, very important information, a relief for some folks who are out there.
Well, thanks again for having us.
Thank you.